Everybody, happy Monday. It's Monday. This is Dr. Stephanie, your double board certified critical care physician, and I help physicians that are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. And I had to think for a minute what day it is. It's Monday. I am just getting home from a locums assignment, and the weather is bad in the Midwest and moving towards the Northeast. So I hope if anybody was traveling today that they were able to make it home safely. I know my flight was canceled and I had to reschedule my flight. So I'm just glad to be home. And I'm just hoping that everybody else who is traveling, especially if you're traveling for work or fun, that you guys made it home safely. But I thank you for joining me. And I just wanted to hop on this Facebook Live really quickly and talk about 3 reasons why every physician entrepreneur should do locums. But before I get started, I have a favor to ask. If you are watching me live, just drop a comment in the comment section. If you are watching this on replay, type replay. If you like a comment, hit the like button. If you love a comment, hit the love button. Please feel free to share this video and tag anybody that you think could benefit from this information. So 3 reasons why every physician entrepreneur should do locums. Hey, Dr. Camille, thank you so much for joining me. And thank you so much for your support. And I can't wait to see what you have coming up, because your podcast and your Facebook Lives are just always amazing and filled with some great information. But 3 reasons why every physician entrepreneur should do locums. Now, many physicians like myself are taking the leap to entrepreneurship because a lot of times we're just frustrated with the current state of medicine. We want to offer, hi, Dr. Shoab, thank you for joining me. Please forgive me for mispronouncing your name. But a lot of physicians are making the leap into entrepreneurship. We're frustrated with the way medicine is going in this country. A lot of us have different ideas and products and services we want to share with the world. So a lot of physicians are transitioning to being, entrepreneurs, because the lure of being your own boss is just something that is pulling a lot of us. However, while this venture into entrepreneurship is exciting, it can be a little scary and it can be wrought with challenges, and it can be kind of frustrating. And so that's why I recommend, and it's for these reasons that I recommend that every physician entrepreneur do locums. Now, let's be honest. We've all heard the statistics about small businesses and their failure rate. And according to the U.S. Bureau of Labor Statistics, 20% of small businesses fail in the first year. 20% of small businesses fail in the first year. And that rate skyrockets to 50% in 5 years. So in 5 years, 50% of the small businesses will no longer exist. And one of the many reasons for failure is due to lack of funding, meaning that, 29% of small businesses that fail because they ran out of cash. So here's the reason why every physician entrepreneur should consider doing locums. And it's because doing locums can fund your small business. Doing locums can fund your small business. So just think about it. If you need some extra infusion of cash in your business, or you need an extra infusion of cash in order to expand your business, working a couple of locum shifts a month can be the bridge that you need. So doing locums can fund your small business. I've done it. I know a lot of doctors do it. A lot of doctors who start their own private practice while they're building their practices, while they're waiting to expand their patient panel, they go do locums somewhere else. They go do locums in urgent care. They do locums hospitalist, because making that few extra $1,000s a month can be the difference between keeping your doors open and having to close your business. So doing locums can fund your small business. Secondly, locums work provides a transition. We are all physicians and we all love seeing patients. That's what we've wanted to do our entire life. And, even if you're thinking about quitting medicine, even if you're thinking about, transitioning to, your to full-time entrepreneurship, locums work can help kind of ease that transition because, it takes a lot for a physician to say, I'm done. It takes a lot for a physician to say, you know what, I'm hanging up my stethoscope, I'm hanging up my white coat. But if you're kind of still in between, you still love clinical medicine and you still love seeing patients, but you're tired of all the bureaucracy that comes along with that. But then at the same time, you feel this urge to, explore your entrepreneurial side and to build a business. Locums can be that transition because you can still do clinical work, but you're not going to be encumbered by all of the restrictions that come with being an employed physician, while at the same time, you have the freedom to pursue your entrepreneur pursuits. So doing locums allows you the best of both worlds. And the third reason why every physician entrepreneur should do locums is because locums gives you something to fall back on. Once again, 50% of all small businesses will fail in the first 5 years. So worst case scenario, if your small business fails, if your entrepreneurial pursuit fails, if your foray into non-clinical medicine is not what you desired, locums will allow you to have something to fall back on. And this is why we physicians know that once you're out of clinical medicine for a set period of time, and I think it's for as little as 2 years, it is very difficult to get back into clinical medicine, if not nearly impossible. However, while you're doing your other thing and, running your small business and pursuing your business passions, you can still do locums, even if it's 1 or 2 shifts a month. And that will still help you keep your clinical skills updated, but it will also help your CV to continue to have clinical work so that when you want to get back into clinical work on a more consistent basis, you'll have the credentialing in place so that you'll be able to do so. So doing locums gives you something to fall back on. So that's why I say every physician needs to do locums, especially my physician entrepreneurs, because I'm an entrepreneur myself. And one of the reasons why I do locums is because I'm able to, continue to do critical care medicine, which is my heart. I think I was put on this planet to be a critical care physician. And I don't know if I'm ever going to want to give that up. It's just in my blood. It's just what I do. However, I want to pursue other aspects of my life and develop other skills and other talents and put other things to work. So I'm able to do my critical care on one hand and to do my other entrepreneurial exploits on the other hand, and it worked well. So I always talk to physicians and I always encourage people to pursue your entrepreneurial desires. However, you kind of need to have a plan on how you're going to do that. And locums, it should be a part of that plan. Dr. Camille says, as an OB and surgeon, I don't think we can go more than a year with no deliveries or surgery. So that's really important because if you're a surgeon or an obstetrician like Dr. Camille is, you can't be out of clinical work for more than a year and think you're going to get back in it. And so that's why it's very important that when you're making this transition from clinical medicine to physician entrepreneurship, that you continue to have your hand in the clinical aspect of it, because you may have to go back to that. And even if you don't have to go back to that, sometimes you just want to keep it up because that's what you love to do. So like I said, I'm just going to go back through this right quick. One of the reasons why, as a physician entrepreneur, you need to do locums and you need to incorporate that in part of your entrepreneurial plan is that small businesses fail at a high rate. 20% of small businesses fail in the first year. 50% of small businesses fail in the second, in the 5th year, and 29% of all small business failures due to lack of funding. So doing locums can help you fund your small business because you need some extra cash for your small business. Go work locum somewhere. I've done a couple of other Facebook Lives that talks about how you can maximize your income as a locums doctor this time of the year. So if you need some extra money this time of the year, go work some extra shifts. And if you want to kick that into overdrive, go work some extra shifts on the holidays. Go work Thanksgiving, go work Christmas, go work New Year's Day, and make extra money. And then you can take that money that you've earned doing locums and fund your business. And the next thing is locums can serve as a transition from, hey, Dr. Tanya, how are you? Thank you so much for joining. Locums can serve as a transition locums can serve as a transition from, doing full clinical work as an employed physician to doing entrepreneurship. It can help you have your hands in both worlds, because you don't necessarily want to give up your clinical skill set, because we're all physicians and we all love seeing patients, and that's who we are. We're not trying to hang up our white coats and hang up our stethoscopes to go pursue this, but at the same time, we may be restricted from being an entrepreneur based on the terms of our employment contract. So locums can give you the best of both worlds. You can continue to practice clinical medicine and you can pursue your entrepreneurial pursuits. It's a nice marriage of the two. And this is very important, locums gives you something to fall back on. Like I said, 20% of small businesses will fail within the first year. 50% of small businesses will fail within 5 years. 29% of small business failures are due to lack of funding and running out of cash. So the reality of the situation is you might have to go back into clinical work. You might have to get a job, may have to get a day job. Locums give you something to fall back on. Because you, like Dr. Camille was saying, if you are a surgeon, if you are an obstetrician, or if you are any physician that has a highly a practice that deals with procedures, you may not be able to be out of clinical practice for more than a year before you can't get back in clinical practice. And in some instances, if it's not a year, it's 2 years. So you have a very short period of time in which, once you make the decision to stop practicing clinical medicine, that's a permanent decision. However, locums allows you not to have to make that decision, because you can do locums 1 or 2 shifts a month. You're still keeping your skill set up. You're still practicing clinical medicine. And most importantly, on your CV, you don't have any gaps in your CV that you have to explain when you want to go back and get privileges. So like I said, I recommend all physician entrepreneurs make locums a part of your plan. Because like I always tell my doctor friends, I always tell physicians, I always tell people who want to do entrepreneurship, because I'm all for that. But I always say this: don't go broke trying to get rich. Just don't do it. Do not go broke trying to get rich. And that's why every physician needs to do, every physician entrepreneur needs to do locums. Now, for those of you who are interested in doing locums, you want to get started in locums, you need more advice about how to do locums, I am inviting you to download your free copy of my locums ebook. And that is at Dr. Stephanie Locums ebook. That is bit.ly, Dr. Stephanie Locums ebook. And for those of you who are interested in locums, for those of you physicians who need more of a resource in locums, I encourage you to join my Facebook group, Creating Careers in Medicine. Please join that Facebook group, because we are a very supportive network of like-minded physicians who offer wonderful resources for people who are trying to get started in locums and people who have done locums. But be sure that you download this free ebook, bit.ly, at Dr. Stephanie's Locums ebook. Thank you so much for joining me, and I hope you guys have a wonderful Monday and a wonderful rest of your week, and we will talk soon. Thanks, and bye-bye.